Hey everyone, welcome back. We're continuing talking about chapter 22, the heart, starting here on slide 12. We just went over some of the basics of the heart, including blood pathways as blood goes in and out of the heart, that there's a septum, that we're separating oxygen-rich and oxygen-poor blood. Here we're looking a bit more at the gross anatomy. We saw how cardiac contractile cells are branched and striated and connected with intercalated discs. Here we're looking at the gross anatomy and how its structure relates to its function. So we know that the heart has this overall shape. I'm going to, use that standard one that we are taught, but just try to make it slightly anatomically correct. You notice that it's kind of pointier at the bottom, at the inferior portion. Because it's pointier here, the term for this part is the apex. That's usually opposite of what you'd think. You'd think the apex is the top, it's the peak of something. But even like with a mountain, it's pointy at the peak. So here it happens to be pointy at the bottom. The bottom is the apex, the inferior portion is the apex. So the bottom is the apex. The top, where all the blood vessels are coming out, notice how there's a blood vessel here and a blood vessel here and a blood vessel here. There's actually a couple more, but all the blood vessels are coming out from the superior portion. The term for the superior portion is the base. Again, counterintuitive to what you'd think for bottom and top. Apex is bottom, base is the top, where all the blood vessels are coming out. We know that the heart is in your chest, it's in your thoracic cavity. Specifically, it's within the mediastinum, slightly left. When we do Pledge of Allegiance, we were growing up in the United States, you put your hand over your heart like that, slightly to the left. It's within the thoracic cavity, within the mediastinum, within the pericardial cavity. It's nested within two other cavities. The myocardium isn't just arranged straight up and down or straight side to side. The myocardium is arranged in spiral arrangements. And by having spiral arrangements, when the cardiac contractile cells contract, they squeeze like when you wring out a towel. When you wring out a wet towel, the most efficient way to get as much fluid out is by wringing it. We're effectively wringing the heart whenever the heart beats. Rather than just closing like this, it squeezes like that to push blood out the top, to push blood out the base. Spiral arrangement of myocardium ensures efficient pumping of blood, and it squeezes from apex to base. So it spirals kind of like that, so that you pump blood effectively outward, out of the heart, out of the base, because that's where all the blood vessels are. By not having blood vessels coming out of the apex, we're not worrying about gravity just making all the blood come down. We want to make sure blood goes up, especially because our brain is up here. Blood has to get to our brain if we're going to be surviving. When we look at the heart, external features of the heart, we can't see the chambers, the atria, the left atrium, left ventricle, right ventricle. We can't see them because they're deeper. We'd have to cut into it. But we can get an idea of where they are based on external features. Just like in the brain, that there are these deep wrinkles called sulci, there are also sulci here in the heart, or on the heart. Take a look at this anterior view that I just circled. There is a sulcus that kind of goes relatively horizontal. This sulcus is called the coronary sulcus. It even continues on in this posterior view on the right. This is the coronary sulcus. It separates the atria, which are higher up, superior, and the ventricles, the bigger ones on bottom. Coronary sulcus separates atria and ventricles. On the anterior side, you can see fat and blood vessels kind of going in this diagonal. What I've just colored in is the anterior interventricular sulcus. It separates the left and right ventricles. Anterior interventricular sulcus. On the posterior side, we have the posterior interventricular sulcus. If you were to travel around the apex this way, you would find the other interventricular sulcus. They are fairly connected, and we will see that will be important when we get to blood vessel circulation. But the anterior interventricular sulcus basically continues around the apex to the posterior interventricular sulcus. So 3 important sulci here that help us distinguish between left and right sides, left atrium, right atrium, left ventricle, right ventricle. As we've been talking about, as we saw in that earlier pathway in the previous video, we know that these atria, right atrium here, left atrium kind of peaking right here, these atria receive blood from the body. And then they pump blood into the ventricles. So the right atrium pumps blood to the right ventricle, the left atrium pumps blood to the left ventricle. These atria, as I've mentioned, are superior to the coronary sulcus. Because they're only pumping next door and they're pumping down, so they're getting helped by gravity if we're standing up, they don't have to be very strong. They have relatively thin walls, low amount of myocardium, low amount of muscle. Atria do not have to be that strong. They are separated. We saw that there's a septum, and specifically the portion of septum separating the atria is the interatrial septum. So that's found in between these parts. One more unique thing about these atria is that they have expandable flaps. This portion of the heart, which you can see in this cadaver heart, it's got an extendable flap here and then a flap here that's, you can only see a little peek of it for the right atrium and for the left atrium. These flaps are kind of ear-shaped. So they're called auricles, same term you use for your ears, for your outer ears. These are expandable anterior portions of each atrium, and they allow for more blood to be received from either the pulmonary circulation or systemic circulation, and then you can continue pumping blood through the heart and then to the rest of the body. So auricles are just a expandable portion of each atrium. Looking inside of the heart, that's what we see here in these illustrations and cadaver picture, we can better see the ventricles. Ventricles, as we've mentioned, are inferior to the coronary sulcus. So they're the larger chambers down here. The walls for these ventricles are bigger. There's more myocardium because they're delivering blood, or they're sending blood outside of the heart. And that's going to take more energy to push blood that far. We're not just pushing blood next door, we're pushing blood out somewhere that isn't the heart. The right ventricle pumps blood to the lungs. The right ventricle pumps blood to the lungs. The heart's right here in your chest, the lungs are next door. So they also, this right ventricle, while stronger than the atria, doesn't have to be that strong. The left ventricle pumps blood out the aorta to the rest of the body, to the head, to the arms, all the way down to the feet. So the left ventricle is going to be much thicker. There's much more myocardium. It's the strongest part of your heart. Take a look at this illustration at the top right. You can see the amount of myocardium here in the left ventricle versus the amount of myocardium here in the right ventricle. Significant difference in the thickness here. And you can see that thickness also in this cadaver heart. What I'm tracing is the myocardium of the left ventricle, this heart that's been cut in half, and then here in blue is the thinner myocardium of the right ventricle. Separating the two ventricles, that's the interventricular septum. So blood should not pass in between these ventricles. We want to ensure that blood doesn't mix, that deoxygenated, poorly oxygenated and rich oxygenated blood doesn't mix, because we want to keep it going in one direction and get efficient delivery of oxygen to your tissues. To ensure that blood is flowing continually in one direction, we have valves. Valves ensure that blood flows in one direction, we don't get backflow, there's no mixing, and we're constantly circulating oxygen-rich blood to the tissues that need it. There are 4 valves in the heart. There are 4 valves in the heart. And we can name them in pairs. This first pair that we're going to name are the atrioventricular valves. Atrioventricular valves, because they're between the atria and the ventricles. The tricuspid valve, you can see over here, the tricuspid valve has these flaps that open up in one direction, but they close when pushed in the other direction. So they let blood go from the right atrium to the right ventricle. The tricuspid valve lets blood go between the right atrium and right ventricle. I remember this, tri is on the right. Tri is on the right side. The bicuspid valve is on the left side. You can see it over here. It's labeled as mitral. A mitre is a bishop's hat. A bishop's hat has 2 flaps. Bicuspid means 2 cusps, 2 flaps. So yeah, the bicuspid valve lets blood from the left atrium to the left ventricle. This is oxygen-rich blood going from the left atrium to the left ventricle. In this superior view that you see here on the bottom left, in the superior view, you can see the tricuspid over here and the bicuspid over here. What is not shown are the blood vessels what's not shown is you have to imagine that the atria have been like ripped off, and now you're just seeing the ventricles and the valves that lead into them. The other pair of valves are the semilunar valves. Semilunar means half moon shaped. The cusps are half moon shaped. Whoops. In between the right ventricle and the pulmonary trunk. So let's look here. Here's the right ventricle. Then here's the pulmonary trunk. There's a valve right here. That valve is the pulmonary semilunar valve. We're regulating blood flow between the right ventricle out to the pulmonary circulation. The top-down view, you can see that here. It's the most anterior of these valves, the pulmonary semilunar. The other valve is kind of hiding. It's hiding back here. So it's behind the pulmonary. And it'd be more accurately right here. This is the aortic semilunar valve. The aortic semilunar valve allows blood to go from the left ventricle to the aorta. We're regulating blood flow to the systemic circulation. So 4 valves, tricuspid, bicuspid. Those are the atrioventricular valves, and pulmonary and aortic, those are the semilunar valves. How do they function? It matters when they open and when they close, because we want to regulate flow of blood, and we want to pace out when blood enters and exits the heart. Introducing a term here, the term is systole. We pronounce the E. Systole is when that particular chamber contracts. So ventricular systole is when the ventricles contract. First, it's important to know that when the heart beats, when these chambers contract, they take turns. Both left and right atria contract while the ventricles are relaxed. Then the atria relax, and then the ventricles contract and relax. Atria contract, relax, ventricles contract, relax. Left and right atrium, left and right ventricle. So during ventricular systole, when both left and right ventricles contract, the atrioventricular valves are closed, and then the semilunar valves are forced open. Take a look here first. We're just zooming in here on the left ventricle. This is the left ventricle, and it's contracting. Since the left ventricle is contracting, blood is going to get forced out. Blood is getting forced out of the aortic semilunar valve. Aortic semilunar valve is open. It goes out the aorta. Similarly, the right ventricle will be squeezing. When the right ventricle squeezes, blood is forced out the pulmonary semilunar valve. So both semilunar valves are open. Both semilunar valves are open. Because these valves are one way, the atrioventricular valves, the bicuspid and the tricuspid, blood cannot go out that way. And that's good. We don't want backflow. Blood will not backflow from the ventricle to the atria. Blood never flows normally from ventricles to atria. We only want blood to flow from atria to ventricles. So both the tricuspid and the bicuspid valves are closed. To further reinforce these valves so that they don't open up the other way, if you push something hard enough, like an umbrella, if you have an umbrella in the wind, it can flip the umbrella out the other way. You don't want that, that breaks the umbrella. We don't want our valves to flip the other way. To prevent them from flipping, we have these structures called chordae tendineae. There are these tendon-like strings that are attached to muscle. The muscle that they're attached to, they're big bumps. The word for bump is papillary. We've seen that word before, remember, in skin. It's attached to papillary muscle. The papillary muscle tenses, it pulls on the cord, pulls on the chordae tendineae, and it prevents the valve from inverting. Together, chordae tendineae and papillary muscles tighten up, prevent valve inversion, specifically of the bicuspid and tricuspid valves. So you'll see these papillary muscles in both the right, they're found in the right ventricle and the left ventricles. That's all during ventricular systole, when the ventricles contract. What about when the ventricles relax? The word for relaxed phase is diastole. Diastole. When the ventricle is relaxed, so here we're looking at the left ventricle, when it's relaxed, it's not squeezing, so it can passively take in blood. Blood is passing from the left atrium into the left ventricle. Since blood is passing through, that means those atrioventricular valves are open. The bicuspid is open, the tricuspid is open. Ventricles are filling up. We want the ventricles to fill up to capacity before we squeeze it out. We want to build up pressure so that it's easier for blood to flow out. To build up pressure, we want to keep our aortic and pulmonary semilunar valves closed. So you can see the aortic semilunar valve is closed in this instance. You can see a nice top-down view of the closed valve here. Since the atrioventricular valves, the bicuspid and tricuspid, are open, that means the chordae tendineae are loose, the papillary muscles are loose. We don't need to reinforce it because we want it to be open. So those are some of the basics here of the timing of when these valves open and close. We'll look at more in detail about this as we go through. In the next video, we'll look at each chamber, the type of muscle that we find in each chamber and how blood flows through. So look out for the next video, breaking this up into 4 parts. Let me know if you have any questions. Thanks, talk to y'all later.